Hello, I'm the Nordic Investor, welcome back. I'm Swedish and I moved to Brazil over 5 years ago, and in this channel I talk about my life here in Brazil and also how I've stopped working and live off my investments. And in today's video I want to talk about the cost of healthcare in Brazil. So Brazil has a public health service which is free, it's called SUS, but then it also has a very big private health sector as well, with lots of people paying for private health insurance. So in this video I'm going to go through all of that, share my experiences and also how much I pay for health insurance. So let's begin. Okay, so let's start off with the public health service in Brazil. So that's available to all Brazilians and people living here with visas. So I'm able to use it as well. I've got a permanent visa here in Brazil. And this is called SUS, S-U-S, and so this includes GP centers, walk-in clinics, hospitals, and more specialized centers as well. And my experience with the Brazilian public health service is that some parts are really good, other parts, on the other hand, are not the best. And so what I end up doing is that I use the public health service for some things and private health for other things. So just to explain a bit how it works here in my town, so I live in the south of Brazil, in a small town in the countryside. It's got about 20,000 inhabitants in this town, and so the public health service in this town includes GP centers, one walk-in clinic, and one hospital. And for my family and I, we mainly use this walk-in clinic. And so this clinic is open from 8 in the morning to 8 in the evening, and you just have to walk in there, tell them what the problem is, and then sit and wait to see a doctor. And this works really well in our town. So usually when we go there, we just have to wait for less than half an hour to see a doctor, and the service and all the doctors and nurses are really good. And so we use this walk-in clinic a fair bit, so whenever anyone gets a bit sick, temperature, coughing, and you just want a checkup, or someone injures their arm or leg or something and you just want to check that nothing was broken, then we go to the walk-in clinic. And recently I had to take my daughter there because she injured her arm, so we had to wait about half an hour. The doctor examined her arm, wanted an x-ray done, so then we had to go to the local hospital where they've got the x-ray machine. Then they x-rayed her arm, and then we went back to the doctor at the walk-in clinic for her to look at the x-rays. So normally it took about an hour and a half to do all of these things, but it was all very smooth and we didn't have to pay anything. Now all towns don't have these walk-in clinics. For some towns you have to go to the accident emergency and hospitals, so it all kind of depends. So the second thing that the public health service has in my town is the GP centers. So it's got about 5 GP centers scattered around the town, kind of small buildings. And there you've got a general practitioner, a nurse, also a physio and a dentist. Now to book appointments here, if you just want to book an appointment with the GP, it's usually about 3 to 5 days before you can see the doctor. So basically if it's something urgent, then you go to the walk-in clinic and not to the GP. So we don't use the GP much, because usually when we need a doctor it's a bit more urgent, and so we go to the walk-in clinic. And like I said, it's also got a physio and a dentist, so you can actually get that as well for free on the public health service. But for those it's a bit more complicated, the waiting times are a lot longer, so they don't just wait 3 to 5 days, it's much longer. So in the end we've never used the dentist or the physio at these places. And then finally, my town has a small hospital, so obviously deals with the more serious cases, so it's got an accident and emergency. And then also if you need any exams done, like x-rays or blood tests, it's done at the hospital. Now that's the public health service in my town, which is quite small. It's not going to be the same all over Brazil. And my experience in general is that in big cities, the public health service is not as good. So we've had to go to 1 or 2 walk-in clinics and hospitals in some big cities, and there we've had to wait for 2, 3, 4 hours to be attended by doctors. Some of the buildings are not very well maintained, and so basically it wasn't a great experience. Now we just used a public health service for these minor things, So you're a bit sick, or you've injured your arm or something, and you get it checked out. But I know some people have had surgeries through the public health service, and that is a lot more complicated and difficult as well. So there are very long waiting lists for people to have surgery. So I know one person who's injured their back and needed back surgery, and that's taken a couple of years for him to have that surgery. So he's had to battle through a couple of years of pain and taking lots of medication, waiting to have this surgery. And so what we do, if it's something more serious which requires surgery or anything like that, we use the private health service and not the public health service. So let's now talk about the private health service. So this is a big industry in Brazil. You've got lots of private doctors, lots of private hospitals, and lots of people have private health insurance. And that's what we've got. And so for myself, my wife and my daughter, we all have private health insurance, and so I pay each month a fee for that. Now there are lots of different health insurance providers in Brazil, and the big ones are Bradesco Saúde. So that's a big Brazilian bank that also offers various insurance policies and health insurance. Another one is Unimed, which is also very big. Then you have SulAmérica and various others. And these health insurance providers, they have various plans ranging from very simple, where you can only use certain private health services, and then you have much more expensive plans where everything is covered. Now private health insurance can get pretty complicated, but just to try and simplify it a bit, most of these providers, they have national and regional health insurance. So the national plans are more expensive because then you can use private doctors and hospitals in the whole of Brazil. So if you're visiting another part of Brazil and you decide that you want to go and see a private doctor in that area, then with the national plan you can do that. And also if you need to do a surgery or treatment, then you can choose from a wide range of hospitals from the whole of Brazil. And then you have the other plans which are regional. So that means you can just use private doctors and hospitals in your area. And that's actually what I've got. Because I just use the local private doctors here. And if I need to do any surgery or anything, then the private hospitals here are very good in this region. So for me, I'm happy to pay a lower premium and just use the regional private health service. And just to show you roughly how much private health insurance costs here in Brazil. So this is the health insurance provider Unimed, which you've got in most parts of Brazil. And here you can see the prices per age of having health insurance with Unimed. Now this here is the national plan for Sao Paulo from last year. So the prices have gone up a bit since then. But it gives you a rough feeling. So a person in their 30s is going to pay about 400 reais per month to have this national health insurance. And 400 reais is $80. So you're basically going to pay $80 a month and you'll have this private health insurance. As you can see, obviously it increases a lot with age. So you can see here people over 60, they're going to pay 1,600 reais, which is over $300 per month. Now these prices are different depending on where you live. So in Sao Paulo it's probably a bit more expensive. And also this is national, so if you go for a regional one, it's going to be less expensive. So for example, I have a regional plan, so I'm in this category here, and I pay 340 reais per month, which is $70 a month. Like I said, health insurance is a lot more complicated than this. You've got various options to choose from, but these numbers here are just rough numbers because Unimed offers various plans. So there are plans where you can just use certain private doctors and hospitals, and then they got more expensive plans where you can use the whole list of hospitals and private doctors. And then also you need to decide whether if you get sick you need to go to hospital, whether you want a private room or a shared room, and then also whether you want to pay a small amount every time you go and see a doctor or go to the hospital, or if you don't want to pay anything. So for example, on my plan, I have to pay a small fee every time I see a private doctor or I go and do an exam. So every time I go and see a private doctor, I have to pay 40 reais, which is $8. But you can choose a slightly more expensive plan where you don't have to pay any of these fees. Obviously the monthly cost will be higher. Now to get these health insurance plans, so for some of them you just go to their website and you apply there, and with others you have to buy them through brokers. And they ask you lots of questions about your health, and some of them actually require you to do a blood test before they approve you. Now we use the private health insurance when we need to go and see slightly more specialist doctors, which would be very difficult and you'd have to wait a long time on the public health service. And then also when we want to do our annual checkups, we also go to a private doctor, and he'll also request us to do various blood tests as well, and that's all done privately. And then finally, obviously, if we need to do any surgeries or anything, we'll use private hospitals to do those surgeries. And these private doctors and hospitals here in the south, in my region, are very good, modern. Doctors are very nice and professional, and I'm really happy with the service that they give. So basically I just want to show you that someone in the 30s, you'd pay less than $100 per month, and you get very good health insurance and access to good doctors and good hospitals. Now there is one other option that you can go for, and that is not to have a private health insurance, but instead just pay every time you need to go and see a private doctor. Now we've done that a couple of times. Usually it's when we go to a different part of Brazil and we just need to mark an appointment to go and see a doctor for some reason, and so we just pay a one-off fee to have an appointment with the doctor. Now these fees can vary a bit, but usually we pay about 400 reais for one appointment with a specialist doctor. So 400 reais is $80. A majority of the private doctors, they have both. So they accept patients with health insurance, and then they also accept patients that just want to pay this one-off fee to see them. And actually quite a few doctors, they prioritize people who want to pay this one-off fee, because I think they earn more than they do from patients with health insurance. So actually if you're willing to pay that one-off fee, you can get appointments quicker than if you have health insurance. So for example, a couple of months ago, I wanted to book an appointment with a specialist doctor using my health insurance, and I had to wait 2 weeks to see that doctor, but it was fine, it was nothing urgent. But had I just paid this 400 reais fee, I could have seen them in 3 days. But you do have that a bit, that you have to wait maybe 1 or 2 or 3 weeks to see a private doctor with your health insurance, but if you pay you can see him a lot quicker. But in general, if I want to see my private GP or something, I can see him in like 2 days, and most other specialist doctors, when I've gone to see them, I can book an appointment in like 3 or 4 days. But there are a couple of private doctors, I guess there's just more demand for them, and so you have to wait a bit longer unless you're willing to pay this fee up front. And to be honest, for me, I think this option of just paying this fee every time you want to see a doctor would have been cheaper for me than having the health insurance, because I generally have not gone to see many doctors. But you run the risk that if one day you do need to have a big surgery or a long treatment, then suddenly it's going to cost a lot of money. But if you have the health insurance, then they'll cover that for you. So I'm sticking with the health insurance because of this risk. Okay, so hopefully you found this video helpful. So you kind of got 3 options here in Brazil. You can either use the public health service, or go for health insurance, or just pay every time you want to see a private doctor. Now I know a lot of people who just use the public health service here in Brazil and are fine with that. And then there are lots of other people like me who kind of use a mix of the public health service with private health when it's better. Now in this video I didn't talk about dental care, and also I didn't talk about the price of medicines and stuff like that, because I'm going to leave that for another video, which I'll do. So if you like this video, leave a like, subscribe to my channel. If you've got any questions, leave in the commentary below. So thanks for watching, until next time.